Mrs. Jones, my name is Ashley. I'm going to be your student physical therapist today. What brings you in?
I had a car accident. I've been having a lot of pain and stiffness in the right side of my neck from, I guess, whiplash.
Okay. All right. Well, the first thing I want to have you do is kind of rate your pain for me so we can have a nice base here. So on a 0 to 10 scale, 0 being no pain at all, and 10 being the worst pain you've experienced, what would you choose?
I would say it's about a 4.
Okay. All right, so now I'm going to take your blood pressure and your pulse here real quickly. Mine, may I do that?
Yes.
All right. Go ahead and do the blood pressure as well. Don't mind me just rolling up your sleeve here. Just rest your arm up there for me. Okay, great. Now I just want to kind of get a look at your neck here, so I'm going to take a couple measurements, so I'll be standing behind you. Alright, so first of all, if you can just kind of sit up straight here for me. Make sure your head looking straight ahead. Let's see here. Alright, so first of all, can you try moving your head to your right? Just look to your left and then your right. Good. All right. So now look straight ahead for me. All right. Can you try and turn your head to your right? Okay. And now come back center for me and then try to move to your left. Okay. Alright, so it looks like you're a little bit more limited on your right side than your left. I am going to be probably having to use a hot pack today for you. Before we get started with that though, I'd like you to go put on a gown for me, just so that we don't get your clothes wet or anything. Would that be okay?
Yes.
Alright, so go ahead and put that on for me. Okay, we'll see you back here in just a second. Alright, Mrs. Jones, well today I'm going to use a hot pack on your stiff neck to kind of help warm it up. What this is going to do is going to help to make stretching your neck a little bit easier. We said that right side was a little bit tighter. It didn't seem like you're going very far, so that'll help that. So it's going to help to loosen up the joints and muscles. You can work on your ability for moving your head side to side, as well as if you have any issues going front to back, or even left to right. So the hot pack is gradually going to warm your skin. It'll be similar to kind of like a soothing bath. Like warm water on your back. It might even make your neck a little bit damp as well. So hot packs are generally used to kind of reduce pain and speed up your body's ability to heal. They're commonly used to reduce the stiffness you have in the joint, and again, to warm your muscles and other structures around the area so that it makes it easier to move and stretch. Okay. So prior to using this hot pack, I just want to make sure there isn't any reason that I shouldn't apply heat to your neck. Have you experienced any recent trauma that caused severe bleeding?
No.
Okay. What about any large bruises, maybe felt faint, or experienced any increase in size of your abdomen or pain?
No.
Okay. Have you ever been diagnosed with a blood clot?
No.
Have you ever been diagnosed with cancer?
No.
Okay. All right, so now I just want to Kind of check out to make sure you know which side I'm touching on your neck. Check your sensation here for me. So if you could just close your eyes for me, and then just tell me which side of your neck I'll be touching you on.
On my left side. And on my right side, more to the front.
Okay.
And on the front of the left side. And on the right side of my neck.
Okay, good. Thank you. All right. Just for your safety, I do have a few additional questions for you. Is there any chance you could be pregnant at this time? Okay. Have you ever been diagnosed with any heart problems or conditions?
No.
Have you experienced any recent tingling or numbness in any of your extremities or anywhere else in your body?
No.
Have you applied any ointments or creams to your neck today?
No.
Okay, that's good. And then another question for you. Do you have any metal inside you or located around that area, or if you're wearing a necklace today?
Nope, I don't.
Okay. So that should be good. Alright, so now I just kind of want to take a look at your skin here a little bit. Don't mind me. Yeah, that's good. Alright. So the back of your neck looks great as well. You don't have an open wound or any swelling. Temperature of your skin feels normal as well. So the hot pack should be a great option for us today. Alright. So also when using a hot pack, just to let you know kind of how your body is going to respond to using heat. Your blood vessels can actually expand, so they will become larger. The speed of healing can increase. Right. Pain sensation can also be inhibited, so the pain that you're experiencing with your neck will help to decrease that for you. Okay. And it also tends to speed up the rate at which your nerves are going to fire. And then after heat is applied to your neck, it actually may make your neck feel weak for a little while. But most importantly, it's going to help to relax these muscles, so we can work on some stretching later.
Okay, sounds good.
Alright, so in order to do this, I'm going to be applying 7 layers of towels to protect your skin. So we've got some right here. We've got the hot pack here for your neck, your knee. Treatment's going to last about 20 minutes for you, but I'm going to check on you about 5 minutes afterwards. Make sure everything's going all right. I'm also going to provide you with a bell in case you need anything, or if you experience any discomfort. And then if you actually have like a rice or a corn pack, hot pack at home, you can do the same thing. Just heat it in the microwave, and then you can do it for about 20 minutes. Twice a day should be sufficient, and you can try this for about 2 weeks.
Okay.
Now, do you have any hot packs at home?
I do, yes.
Okay. And you should be able to heat it probably for like a minute or so.
Okay.
Just so it's a good temperature for you. Alright. So there are a few unfavorable effects that you can experience with hot packs. Just to let you know, your chances of bleeding increase because your blood vessels can expand, as I mentioned earlier. You also may feel faint. Okay? So if you do start to feel faint while we're here, let me know so I can tend to you. Also be aware that hot packs can burn your skin if they are too hot or if they're left on longer than 20 minutes.
Okay.
This can damage your tissue if it does tend to burn your neck. This is why I'll be checking on you during treatment just to make sure that everything's going all right.
Okay.
All right. So Mrs. Jones, can I have your consent to apply this hot pack to your neck?
Yes.
All right. Great. All right, Mrs. Jones, so we're going to put this hot pack on your neck here. If you wouldn't mind just laying down this time. Okay, kind of scoot back here a little bit for me. Thank you. All right, so I am going to Velcro this so it can stay nice and tight around your neck. Okay, does that feel all right to you?
Yeah.
Okay.
Good.
All right, so I'm going to be leaving you a bell here. Be right next to your side.
Okay.
If you need anything, just ring, let me know. I'm also going to set a timer here. Set it for just 5 minutes, and then I'll come back in 5 minutes and check on you.
Okay.
Right here.
All right, thank you.
Mrs. Jones. So it looks like it's been 5 minutes here. How are you feeling?
Good.
Good. Okay. I am going to take this off here for just a second so I can check your skin, make sure everything's all right. Okay. Now if you could just sit up here for a second. All right. Now it looks pretty good. Looks like you're getting just a little bit red here. Okay. So I might go ahead and make sure that towel is nice on there. Okay, go ahead and lay back down for me. Alright, so I'm going to go ahead and put this back on. So no pain or anything
No.
from the heat?
No.
Okay, good. Put this back on for you. Okay, now go ahead and set this for another 15 minutes. Okay, and then I'll be back. You still have the bell here. If you need anything, just let me know.
Okay.
All right, Mrs. Jones, so now we're going to go ahead and take this hot pack off here. All right, if you can go ahead and sit up slowly for me. All right, you feeling okay? Mm-hmm. All right. So your skin looks good here. Just a little bit of redness, a nice warm to the touch. All right. I'm going to go ahead and take some measurements. Okay. So same ones we took earlier. You can just look straight ahead for me. Sit up nice and straight. Okay, can you move your head from right to left? Alright, now come back center. Okay, go ahead and move to the right for me. Okay, good. I'll go ahead and switch up. You're going to move to the left. Okay, very good. So what would you rate your pain score right now on a 0 to 10 scale? 0, no pain, 10, worst you've ever experienced.
A 2.
Okay, that's better from earlier, so that's good. Now we're going to go ahead and talk about some exercises that we can do for you at this time.